First 1 million doses of the Oxford AstraZeneca vaccine will arrive in South Africa from India later today. The President, his deputy and the Health Minister are among those who will receive the shots at OR Tambo International Airport. The second batch of 500,000 jabs is due to arrive later this month. Professor Francois Venter from Wits University joins us now via Zoom. I mean, this really is a day to celebrate, isn't it, Francois? It took a while, but they're here. What are the expectations today?
So I think the expectations are we get this into the arms of people who need it as quickly as humanly possible. You know, things have been delayed. We desperately need them. The second wave has taken a terrible, terrible toll on the country, and we need to protect as many people as possible before the third wave. So it's very encouraging. It is only, unfortunately, less than 1% of the people who are going to be vaccinated with the current crop. So we need to be focusing our minds on getting more vaccines as quickly as possible.
And not too many ministers either ahead of us. Is that a good start, though, if the President is to take it? I mean, is that the right message? Yeah,
I think that, you know, people are a little bit all over the map about politicians being vaccinated first, but I really do think that the minister, our major political party leaders, everybody should be in the front of the queue so we deal with vaccine hesitancy. Somebody from the States used this term unbelievably encouraging about the vaccines, and I think people need to understand that these vaccines are performing at a level none of us even dreamed of. There's not been a single death yet from somebody who's received from COVID who's received the vaccine. So it doesn't matter which one it is. They're all performing at a level we did not even think was possible.
Okay, so let's get down to the basics. This vaccine, I mean, some people have had allergic reactions to that. Can you address that for us? And when can you take the vaccine? I mean, can you take it when you've got COVID? Would it be efficient then too?
So the first thing is that there have been some allergic reactions, and these things are not without their side effects, but relative to what COVID does to you, it's a minor walk in the park. So I think that people need to understand that there's no such thing as a vaccine without a side effect. But it's a bit of a sore arm and feeling a little bit blah for a day or two, and maybe for a few days after that. But it really is, in terms of the side effect profile, is very, very short. And if you've had a reaction to a similar vaccine in the past, which is very unusual because these vaccines have only been around recently, and that would be the reason to not take it. But honestly, you're going to have so many options soon that you're going to be able to pick and choose which vaccine you want.
Oh, wouldn't that be good? And tell us how it works with antibodies. Is there a time when you shouldn't have the vaccine? For example, if you're sick with COVID, can you still take it? And how long can it last for?
We're not certain. We've only had this virus for a year, and we've only had the vaccines for a few months in clinical trials. The indications early on are that if you've had COVID, all it's going to do is boost your immunity, and you're not going to get sick the next time around either. If you do have antibodies, which indicate the previous infection, same story. It's going to probably behave just like a booster, like so many other things do.
And if you've got antibodies, I mean, I'm hearing that it's about 3 months, and then you can get sick again if you're not lucky enough to get the vaccine in that time. Do the antibodies, have they done enough good work in the 3 months that they're in your system to put you in a better position if you were to contract it again?
So it's very clear that if you've had it before, that you have a lot of protection. It may not just be the antibodies. Remember that the vaccines, the immune system's got a whole lot of other things that can do, that are not just antibody dependent. And I'm sure everyone's heard of T-cell immunity now. But there are a whole lot of mechanisms where the immune system will take care of it. There's a massive study from the UK where healthcare workers who have had it before were followed out over time, and not a single one of them got it again. So once you've had it, or you've had the vaccine, you've got at least medium-term protection, and probably longer than that.
Okay, and is there a better vaccine? We've got several heading our way. Is there
They're all unbelievable. I mean, everyone's going on about how the one that was announced on Friday, the J&J one's only 66%, but nobody died who got it, and nobody, like almost no one got severely ill. So you don't take the vaccine only to stop infection. The major reason you take a vaccine is so that you don't end up in hospital or on a ventilator. So people need to understand is that every single one where the 5 big ones that have had data put out there have, as I said, that term ridiculously effective, ridiculously encouraging is just swirls around in my head. We did not expect this to be so effective.
All right, so we are told that other than the President who'll get it today, that it could take about a week. What is it that they'll be looking for in these vaccines before they can tick it off as safe?
It seems to be some sort of bureaucratic and quality assurance process, which is important, but I think they should be looking, we are going to have to move these vaccines into as I said, into the arms of people as quickly as humanly possible, particularly the frontline healthcare workers and the vulnerable.
Francois Venter, thank you.